Everyone, under your seat you have one of these. Can you look? Unfortunately, this is not Oprah. You haven't won a trip to Tahiti. But at the same time, you haven't won diabetes, so consider yourselves lucky. Great, so hold up your circle for me. Great, excellent. We'll just wait for my presentation to load. Just hold them up, we'll get some exercise. It's great, wave them around, different colours, NCDFREE colours, awesome. Is there someone with a red dot? Do you want to stand up for us? Great, give him a round of applause. He's our 1%. You can sit down and we'll explain what that means in a moment if we get our presentation running. We cut the interval short and they needed maybe a bit more time to get the presentation. There we go. So one of the things that I get to do on a regular basis is try and make epidemiology sexy. Not directly. Oh God, that sounded really bad, didn't it? It sounded really bad. I'll start again. So I get to teach epidemiology to master's students, predominantly in Europe, and it's very hard to try and make statistics kind of exciting, and particularly big numbers like we are having with the NCD epidemic. So I'm going to sort of have a take on the wonderful work around if the world was 100 people, and we're going to make this auditorium the percentages of the global population. So this auditorium now represents the globe, and each of you have a voting card. And we're going to use it to try and show you the enormity of the burden, but also the opportunities that this burden represents. So this is your voting power. So I'd like everyone with a blue card or an orange card, that's orange, to hold it up for us. This is the proportion of global deaths that are caused by NCDs. So look around and have a quick snapshot. We'll get some people to stand up in a second, get you really exercising. You can pop them down. If we now go blue, orange, and pink, this is the proportion of NCD deaths, or deaths that are caused by NCDs in Australia, 80%. It's quite alarming. If we now quickly look at type 2 diabetes, just to focus on one of them, where's our friend with the red card? Stand up for us. 1980, only this gentleman had diabetes. Oh, sorry. Today you're still alive and well, don't worry. You've got access to treatment, unlike many people. You can sit down. But green and purple, you stand up. Purple's sort of this dark maroony colour, just FYI. No, that's pink, Matteo, but thank you very much for trying to help us. But we got purple. It's this like dark maroon colour. It's a bit hard to make out. Like this one, there we go. Like Phil. Is Phil the only one with purple? Poor guy. Okay, well we've got someone holding up 2. Thank you very much. 7%, the proportion of Australians with diabetes today. You guys can sit down. Purple, orange, and pink, you guys stand up. Now you can, Matteo. Well done. You were just precocious, ahead of your class. This is the proportion of Australians who are either pre-diabetic or diabetic, 25%. Okay, everyone sit down. And 280 new cases today. Let's quickly now look to China. So our friend with the red card, stand up again. 1980, 1%. Round of applause. Unfortunately, the burden is a little different today, higher than Australia, 12%. So you can just hold the cards up if you like. Orange and purple, I don't know if I have to read them for you still. Well done, thank you very much. Put up your card if you're blue though. So this is the proportion of Chinese who are either pre-diabetic or diabetic in 2013, 50% or 500 million people. This is based on, obviously, estimates, but this is what we believe. Let's look at mental health, and let's look at mental health in Australia. The blue cards can put their hands up again. 1 in 2 will be affected by depression or anxiety in Australia. Have a look around and get the sense of the numbers we're talking about, the proportions we're talking about. Pink, Matteo, you're up. Where's his band of pink helpers? 1 in 5 will experience depression this year alone. And 70%, so pink and blue, of suicides in the world occur in the world's low and middle income countries or poorest nations. If we look at the economics, please stand up for us again. India currently spends, oh, sorry, wrong colour, now I'm colourblind. You can sit down, well done. Come on, if I told you to jump off a cliff, would purple please stand up? Or put your hand up. Phil, there he is. Where's his band? There must be more purples, no? Our master students are very bright and they cut these out, so they're great. Either that or the pink and the blue, you can stand up together. That kind of makes purple. 2% of Indian GDP is currently spent on NCDs, and yet NCDs currently cost the Indian economy 12.5% in lost productivity. And healthcare costs, this is a big one. So I want blue, pink and green all to stand up. This is the proportion of a person's income in Vietnam that is taken to treat just one person for diabetes. Now you imagine that this is the proportion of your income that goes on diabetes care. If you're the sole breadwinner in a family, you can very quickly see how this becomes not only an issue of perpetuating poverty for an individual, but also for a family and a community. You guys can sit down. But importantly, things can be done, and we should be positive because this is the point of NCDFREE. So we need to also remember that 80% of diabetes is currently preventable, 8 in 10. That 1 in 20 deaths globally could be avoided just by improving access to fruit and vegetables. And I think this is the big one. A tobacco-free Australia would have saved $32 billion in lost productivity in 2004. And that is twice the amount we spent on tertiary education in the same year. Imagine the possibilities.